Good morning and welcome to Hot Seat. My guest is Representative Marcus McEntire. Nobody's worked harder on public health issues than you over the past decade. Good to have you.
Thank you for having me. I appreciate it.
For those of us who've worked in public health, we've been wanting for years to have everything data-driven, make sure that physicians and providers could share data. But recently we've seen a kerfuffle break out about behavioral health and records. And I sense that some of this could be confusion, so invited you here to try to clear this up and talk about what's going on. Thanks for being with us.
No, you're more than welcome, and I'm really happy that you brought me on to attempt to at least clear this up.
Got it, because when it comes to health issues in Oklahoma, the confusion it happens, right?
It does.
And as we saw during COVID, not only confusion, but misinformation. And when we're talking about behavioral health, some people have become very concerned about their data, their privacy. But let's start at the 10,000-foot level. You've been working this for years. Help us understand what the confusion is about.
So what the confusion is about, over the past two cycles that we've had, we passed OK Shine, which created the statewide health information exchange that I'll be referring to as an HIE most of the time. And then last year we passed another bill that mandated its use. But what's important, what I think is mostly significant about that bill is that the legislature would not allow the state to have control of that data. And so the state has chosen a state designated entity in a company called MyHealth. It's an Oklahoma-based company out of Tulsa. They've been in business for 13 years. That whole network was created by health providers. The governance guarding or safeguarding mental health care, that was developed by mental health providers. And so this is a process that's already being used in the state. About 3/4 of the hospitals are on it. We are just extending it out to rural Oklahoma. And because we need to be able to make data-driven decisions. And we also need to make healthcare a little more convenient for our citizens. I mean, there's nothing worse than lugging your medical records around from doctor to doctor. This allows doctors to share information, and the Oklahoma citizen, the patient, is in 100% control of their data.
It's an important point,
yes.
Because I've seen people say, man, we're going to have our records going to be out there. The records are private and the patients control it. Is that true? Yes,
yes. I mean, a patient can opt out of these records at any time. There's already governance in place for that existing within MyHealth, the HIE. And so, yeah, if they say, look, I don't want to be part of this process, I don't want my medical records there, they are wiped away. And now you'll have to lug your doctor's records from doctor to doctor if you need to, but your records will be expunged.
You're not concerned about patient records winding up being the privacy being violated?
No, I mean, okay, so this thing is pretty, I mean, I wouldn't say it's locked tight. There's nothing locked down tight. It's nothing that is probably impenetrable, but it has the highest encryption you can have. If somebody not in your care provider group accesses your record, that is audited in real time and flagged, and that will be investigated. So, I mean, I've heard people say that, I don't want, maybe my ex-husband or ex-wife is a physician, and I may be going to counseling, and I don't want my ex-spouse to be able to see my records. Well, they can't. And we can go into that further about what is legal to upload to the HIE and all of that as regards to mental health data.
Let's do that right now. So
yeah.
That's part of the confusion or purposeful misinformation. What's going on there?
So I think there's there was some misinformation. I mean, federal regulations say in Section 42, Part 2, I believe, that no mental health notes from the psychiatrist or the counselor may be uploaded. It is illegal to do that. That was never the intent of the Healthcare Authority rules or this policy in general. So that kind of information in the mental health sphere is not uploaded. People's private thoughts, their private problems, all of that is off. That cannot be sent to the HIE.
Thanks for watching Hot Seat. See this again at news9.com/YourVoteCounts, and follow me on Twitter, Facebook, and LinkedIn. They're all at Mitchell Talks.